MS Ramaiah University of Applied Sciences.
Determination of blood pressure. Aim of the experiment: to determine the systolic, diastolic blood pressure and mean arterial pressure, and to observe the effects of exercise on blood pressure. Introduction. The term blood pressure refers to the force exerted by blood as it presses against and attempts to stretch the walls of blood vessels. The purpose of this experiment is to measure blood pressure, which is an important clinical procedure as it provides valuable information about the cardiovascular system under normal and diseased condition. Experimental setup: stethoscope and sphygmomanometer. Experimental procedure: auscultatory method. Place the cuff around the upper arm with the center of the bag lying over the brachial artery, keeping its lower end about 3 cm above the elbow. Locate the bifurcation of brachial artery in the cubital space just medial to the tendon of biceps. Mark the point of arterial pulsation with a sketch pen. Place the chest piece of the stethoscope on this point and keep it in the position with your fingers and thumb. Inflate the cuff rapidly using air pump. Raise the pressure to 30 to 40 mmHg above the systolic level as determined by palpatory method. Lower the pressure gradually until a clear, sharp tapping sound is heard. Note that as systolic BP. Continue to lower the pressure and try to note a change in the character of the sounds. When the sound disappears, note that as diastolic BP. Analysis: the artery is first compressed by inflating a rubber bag placed around the arm to stop the blood flow through the occluded section of the artery. The pressure is then slowly released and the flow of the blood through the obstructed segment of the artery is studied by feeling the pulse, that is palpatory method, observing the oscillations of the mercury column, the oscillometric method, and listening to the sounds produced in the part of the artery just below the obstructed segment, that is auscultatory method. Hi students, today we are going to study determination of blood pressure. The aim of this experiment is to determine systolic and diastolic blood pressure and in turn calculate mean arterial blood pressure, and also to observe the effect of exercise on blood pressure. Blood pressure can be defined as the pressure exerted by the blood as it passes through the blood vessels as it tries or attempts to stretch the walls of the blood vessels. Determination of blood pressure gives valuable clinical information about cardiovascular system in case of normal as well as diseased conditions. Now let us start the experiment by studying different components which are utilized in this particular experiment. The components which are utilized in this experiment are stethoscope, in which steth means chest and scope means to inspect. Stethoscope majorly consists of 3 parts: chest piece, rubber tubing and ear frame. Chest piece has 2 end pieces. One is called bell and other surface is flat diaphragm. The plastic diaphragm causes magnification of low pitched sounds. Rubber tubing: a single soft rubber tubing is used in the stethoscope with an internal diameter of nearly 3 mm. It starts from diaphragm and leads to the Y-shaped metal connector which is attached with the ear frame. Ear frame, it consists of two curved metallic tubes joined together with a flat U-shaped spring which keeps them pulled together. The upper ends of the tubes are curved so that they correspond to the curve of the external auditory meatus and sphygmomanometer. Sphygmomanometer, in which sphygmo means pulse, mano means thin, and metron means to measure. Sphygmomanometer consists of mercury manometer, a graduated tube, rubber tubing, armlet or airbag, or it is generally also called as cuff, and air pump. The mercury manometer is fitted in the lid of the instrument. One arm of the manometer is connected with the reservoir of the mercury and other arm to the graduated glass tube. Graduated tube. The sphygmomanometer's graduated glass tube is graduated in mm from 0 to 300, with each division representing 2 mm. Armlet or rubber bag, which is usually called as arm cuff. It is an inflatable rubber bag which consists of 2 rubber tubing, out of which one rubber tubing is connected with mercury manometer and other rubber tubing is connected with the air pump. Arm cuff is generally provided with 2 Velcron strips to position the rubber bag around the arm during measurement of blood pressure. Air pump or rubber bulb. It is an oval shaped rubber bulb of size that conveniently fits into one's hand. It has one-way valve at its free end and a leak valve with a fitted screw. Now let us start the experiment and record blood pressure. First, record the systolic blood pressure of the subject using palpatory method, followed by both systolic and diastolic blood pressure are measured and recorded using auscultatory method. Now let us start palpatory method. Palpatory method must be employed before auscultatory method so as to avoid the auscultatory gap. First, make the subject sit in a relaxed position. Using the Velcro strips, place the arm cuff palpate the radial pulse with the index and middle finger near the base of the thumb on the anterior surface of the wrist. While palpating the radial pulse, rapidly inflate the cuff until the blood pressure manometer reads 200 mmHg of the pressure. Once it reads 200 mm per Hg, set the valve on the rubber bulb so that the pressure leaks out slowly, about 5 mm per second. Continue palpating the radial pulse and watch the manometer while air leaks out of the cuff. Note the pressure at which the pulse reappears. In this case, it is 118 mmHg. This is systolic blood pressure as detected by palpation. After determining systolic BP using palpation, now we will move on to auscultatory method of measurement of blood pressure. First, place the airbag or the arm cuff around the upper arm with the center of the bag lying over the brachial artery. Locate the bifurcation of brachial artery in the cubital space just medial to the tendon of the bicep, and place the chest piece of stethoscope on this point and keep it in this position with your fingers or thumb. Inflate the cuff rapidly using air pump and raise the pressure to 30 to 40 mmHg above the systolic level as determined by palpatory method. Then lower the blood pressure gradually until a clear, sharp tapping sound is heard. Once the clear, sharp sound appears, note this blood pressure as systolic pressure. In this case, it is 118 mmHg. Then continue to lower the pressure and try to note a change in the character of the sound. When the sound disappears, note that as diastolic BP. Now the sound has disappeared and diastolic blood pressure recorded in this condition is 74 mmHg. This completes the determination of blood pressure.
At MSR UAS, we spark your imagination unlike any other.